So my topic is about target to the therapy, glucometers. So now we talk about why it's important to test the capillary blood glucose, HbA1c and glucometers, and continuous glucose monitor, and how to utilize the glucometers and when to test the capillary blood glucose. So blood glucose monitoring is a cornerstone of diabetes care. Our aim is to keep the blood glucose level as near to normal as possible because it allows to identify the patterns of high or low blood glucose level, and also it's a guide to suggest if the diabetes under control or help us to adjust the therapy as needed, and also help us to balance the food, exercise, and insulin dose. So being elastic about the blood glucose level is very important. So everyone knows that HbA1c is what's the average amount of glucose attached to the hemoglobin has been over the past 3 months, but it provides a more relevant views of long-term glycemic and future risk of complication. However, it's less affected by the day-to-day variation plasma glucose because of due to the exercise, smoking, medication, and diet patterns. So when the HbA1c is not reliable, for example, any conditions that prolongs or shortens the life of erythrocytes or is associated with increased or reduced the red cells turnover exposes the cell to glucose for a long period of time, it will result in higher or lower HbA1c levels. So in these cases, the HbA1c may not be a true reflection. So when we are evaluating a patient with diabetes who has one of the conditions most commonly such as iron deficiency, vitamin B12 deficiency, folate deficiency, anemia, or who just had a blood cell transfusion, the clinicians should consider that the HbA1c result may be falsely elevated and not reflective of the patient's true level of average glycemia. Here are some conditions associated with falsely elevated or lower the HbA1c. Oh, good. So our aim for self-monitoring blood glucose is to maintain a blood glucose within the target range. And it will benefit for our treatment, prevent the high or lower blood glucose level, and also it will reduce the risk to having a long-term complications and maximize our health. However, there's many variables can impact to our blood glucose, such as illness, insulin, food, exercise, stress, injury. Here are the range of the glucose meter device under the CareSens. This is CareSens N, CareSens Pro, CareSens Premier, and this is CareSens N Voice. They are all, and another new one is called CareSens Duo. For the CareSens Voice, it's not funded and for the top 4 meters, they all using the CareSens N test strip. But for the CareSens Duo, it used CareSens Pro to check the blood glucose and also the ketone sense to check their ketone by using 1 meter. So here's the meters available in New Zealand, which is funded by in New Zealand, CareSens N meter and CareSens N Pro. They just for testing the blood glucose. There's another new meter available in the market, which is has the Bluetooth functions. It's CareSens N Premier and also the CareSens Duo. For the CareSens Duo, it's for type 1 diabetes patient, and they used CareSens Pro to check the blood glucose and ketone sense to check the ketone by using 1 meter. So you might ask, how to get a meter? If patients on sulfonylurea or insulin, they are subsidized by pharmac, they can get a CareSens N Pro or Premier. But the CareSens Duo is only for patients with type 1 diabetes. And for patients on metformin, vildagliptin, or GovMed, they are not subsidized by the pharma. You can give a free coupons, free meter coupon to your patient, or they can purchase from the pharmacy. And also for the funding test strip, they all using the case is for patients on sulfonylurea or insulin is not restricted to one pack. They can check as much, the patient can check as much they want, but the ketone test strip is only 2 packs for 10 ketones. And patient on metformin, vildagliptin, and GovMed, the test strip is restricted to 1 pack per prescription. So you might ask how to utilize the glucometer. There's always instruction inside the glucometer. In general, we need to wash, patient need to wash and dry their hand well, and then insert the test strip and pick the side of the fingertip with the needles provided with your test kit. All meters are slightly different, so it's better for the patient to follow the instructions. And some of the meter it can check the test the blood taken from different sides, such as forearm or palms. So it's very important. This reading may be not accurate as reading from the fingertip, especially they after have a meal or doing exercise. Oh, sorry. And here is the website. If the patient is not quite sure how to use the meter, they can go on the pharmacodiabetes training. And I will talk about, and also we got continuous glucose meters available. We call sensor, which is inserted under the skin. And later on, Dr. Zhang will talk about it in details. And because of the cost is an issue, therefore it's not funded in New Zealand. And we generally, it's more benefit for the patient who's on insulin, particularly for those with type 1 diabetes. The sensor is measure the glucose in the tissue fluid several times a minute, and then they will send the information to the device or insulin pump or a smartphone. And the system will automatically display and record an average glucose value every 5 minutes. So we also suggest like patient need to fingertip pokes to calibrate the device, and also some of the sensor can have the alarm signals when the glucose is out of target. So who should check the blood glucose? So type 1 is depending, the blood glucose target are individualized. So patients type 1 or later, type 2s on sulfonylurea or insulin, or they got a hypoglycemia or hypoglycemia unawareness, pregnant or planning to pregnancy, when adjusting therapy, or patients on Ramadan or having a hard time controlling blood glucose or acute sickness. So you might ask, when should I test my blood glucose? So in general, the frequency of testing blood glucose is depending on your experience, the types of diabetes, or the diabetes treatments. And sometimes we suggest the patient, they advise them to test their blood sugar level before and after meals to see how their blood sugar level responds. And we might suggest them to increase the frequency to test their blood sugar level when they're feeling unwell or having any symptoms of hypoglycemia, especially before they drive, for type 1 diabetes, especially before they are driving, before and after exercise, and also when they change the tire. So generally for type 1, they usually need to check their blood sugar level 4 to 8 times a day. They need to check their blood sugar level before and after meals or snacks, or before and after exercise, or before going to bed. And they might need to also increase the frequency when they are not feeling well or change to a new medication. For type 2 diabetes patients on sulfonylurea or insulin, it depends on the type and amount of insulin they use. And usually we recommend before meals and also at the bedtime, if taking multiple daily injections, or maybe just check it twice a day before breakfast and dinner. if patients on diet control or not on any insulin medication, they can check their blood sugar level every day. So I also know some of patients maybe need to be on the intensive blood glucose, need to check their blood sugar level more frequently, like intensive blood sugar level testing. So we can suggest like them to check their blood sugar, check their fasting every day, then do the before and after breakfast, and then check their pre-bed, and then check their before and after lunch and before and after dinner in the alternative day. So they don't need to check their blood sugar level 6 or 8 times per day, but we still can see their patterns. Also, when we review their blood sugar level from their logbook, we are not just look at the number, we need to find out the reason why there's high or low. For example, the high number may be related to they had a big meals, or it might be because they got a lipohypertrophy, or like the low blood sugar level, it might be related to they just had an exercise, something like that. So we need to also think about these risk of factors as well. Thank you.